Even though there were wars in 17th century Europe, advances in culture, arts, and sciences prevailed. The 17th century saw the rise of what is now known as the scientist. I'm Justin Charles von Possel, and we will be talking about medical advancements during the 17th and early 18th centuries. For this period, we can classify medical discoveries into three categories: the physician, the surgeon, and the dentist. We will be looking at the timeline for this era. As for the physicians, 1590, Zacharius Jannssen invents the microscope. 1628, William Harvey publishes an anatomical study of the motion of the heart and of the blood in animals, which forms the basis for future research on blood vessels, arteries, and the heart. 1624 to 1689, Thomas Sydenham emphasized the importance of carefully observing patients' symptoms. He is sometimes called the English Hippocrates. 1665, Robert Hooke described cells in his book Micrographia. In 1670, Anton van Leeuwenhoek discovers blood cells, and 1683, he also observes bacteria. In 1701, Giacomo Pylarini gives the first smallpox inoculations. For the surgeons, at this time there were still barber-surgeons that performed crude amputations. Cauterization was done with hot iron, and skull trephining was performed to improve blood-brain balance. In 1603, Marie Collinet performed the first successful cesarean section. In 1662, Thomas Hollier operated on the diarist Samuel Pepys to remove his bladder stone via incisions in the perineum. 18th century was when the Age of Enlightenment in Europe occurred from 1715 to 89, and surgery had more of a sound and scientific basis. So 1728 to 1793, John Hunter was regarded as the father of modern scientific surgery, as he did his own surgical experiments and collected over 13,000 specimens of separate organ systems from plants, animals, and humans. 1763, Claudius Amend performs the first successful appendectomy. As for the dentist, we have the one and only Pierre Fauchard. He is a French surgeon, and he became known as the father of modern dentistry. Despite the limitations of that era, he adapted improvisations like using tools from watchmakers, jewelers, and barbers to use as tools for dentistry. He also introduced dental fillings for cavities, which he asserted was caused by sugar derivative acids like tartaric acids. Fauchard believed that the main way people should keep their teeth clean is by washing their mouth every morning with water and rubbing the teeth with a wet sponge. By 1723, Le Chirurgien Dentiste, or the Surgeon Dentist, is published by Pierre Fauchard. The book deals with basic oral anatomy and function, operative and restorative techniques, and denture construction. Again, I've been Justin von Possel. That's it for today. See ya!